Hey, welcome to the episode today. I'm very excited. I have Dr. Adam Christman on today. And I said that correctly, right?
Yeah, you nailed
Okay.
it.
Just want to make sure. I meant to ask you before we started. Um, and we are going to, well, you guys probably know him because he's the vet, he's famous on social media, he's got like what, 5 dachshunds?
Yeah, I had five. Now I have four, but we'll probably go back up to five, six, seven, eight.
Well, as they say, they're like potato chips. You can't have just one.
So true. So true.
Anyway, I'm going to talk to Dr. Adam about a little bit about IVDD and senior dogs, senior dachshunds and age.
Yes.
And yeah, we'll just see where the conversation takes us. So, for those of you just tuning in and don't know me, my name is Jessica Williams. Just don't need to say my last name. Have it. But I am the author of the award-winning Dachshund educational blog called "You Did What with Your Wiener," and so I have all kinds of articles on there. But I've since just started this podcast. We're also kind of on YouTube. Facebook is my big thing, and we are also on Instagram. A lot of our travel pictures. So my big thing is breaking Dachshund stereotypes and traveling and health and training and socialization and all the things that you need to have a good, fun, enriched life with your dachshund. So, um, just a couple things. Adam, it's okay if I call you Adam.
Yes, please.
Okay. um, like I said, he's a celebrity on social media, and he's also a vet educator and winner of the 2023 Bright Minds Industry Influencer Award. And you have 4 dachshunds. So why don't you tell me a little bit more about yourself?
Yes. I've been practicing for, 20 years now. I kind of pivoted into the continuing education realm. So, to those of you that don't know, you're a veterinarian and you're a veterinary technician, they need continuing education to maintain their licensing every year. So, I help put on these wonderful conferences throughout the country, and it's so great to meet many of you out actually that are probably listening and tuning in. I see you around the country, and it's been great. So, I do part-time relief work and then also a lot of social media as well. I love educating pet parents. I go live on TikTok every night where we have thousands of pet owners that we interact with, and we have such a great time enjoying the love of the human animal bond.
Yeah, I tried to, like, I wanted to get, like, I wanted to seem knowledgeable. I mean, of course, I follow you now, but like,
Yes.
I just wanted to go way back, like, in your social media to kind of when you started. And like, I scrolled and scrolled and scrolled. And then it was like last year. So it's obvious that you post a lot.
Yes,
Like, you
I
didn't
do.
go
I
back
post.
to 2005 or anything.
Right. Okay, good. That's good.
I know I started in 2010. I know it's like you look back on what you did when even a year, 2 years ago sometimes, and you're like, ew. It's like kind of
Right.
embarrassing sometimes. We all improve with what we do. So,
But you know what's good about that, though? I will say it's nice to see your evolution
yeah,
because everything is a process. And I do. I look back on my videos and I was like, okay, it was different then, but you wouldn't be where you are today if it wasn't where your process and your journey. And I share that with all of you tuning in because, yeah, I hope you don't look back and be like, oh my God, I look terrible. I was like, it's all part of the process of evolution, of education, and figuring out what your vibe is and everything. And I'm okay with it.
yeah, yeah. And for
Yeah.
me, like as I change and evolve, I'm immersed like in today, right? But I mean, I have
Right.
followers. We just came back from Cannon Beach. There's a big dachshund meetup every year. Cannon Beach, Oregon. Do you know where that's at?
Yes, yes. It's a
Okay.
big one.
Yeah, there's a big one. There's SoCal Wiener Fest in
Oh,
Huntington Beach, California. It's huge, but there's a big one in Seaside, Oregon, which is just north of Cannon Beach, um, called Dachshund. And there were about 400 dachshunds this year, right? And
love it.
anyway, my friend and I camped in Cannon Beach. So in between the events, we were on the beach down there. And this lady was walking. We had 5 dachshunds with us, all off leash, all really well behaved. I mean, they had a drag line, so for like emergency break.
Yeah.
But they were all so good, and of course, everyone's, oh, can we pet them? Can we pet them? But one lady, she had a camera and she like stopped and was looking at me, and it was towards the end of the weekend. So at that point I was just like, okay, I'm gonna keep going. And then suddenly she goes, she must have been 10 feet of, this is Summit, so you can
She's
see it, but
beautiful.
she's
Absolutely beautiful.
one, she's 6, but she, from about 10, 20 feet away, maybe I'm really bad judging distance, she goes, is that Summit? And I was like, yeah. and she recognized her from that far away that it was her. And it turns out she's like, oh, you know, I still follow you, but I followed you from the very beginning. And that was for me, 2010, end of 2010, very beginning. And it's so nice to finally meet you. She wanted to do a selfie and all this stuff. And so I really do appreciate the people that have stuck with us. And they have, to me, I'm like who I am today, right? Sometimes I forget all of that past stuff, but these people have seen me evolve.
Right.
You know, in the beginning, it was just sharing. I hike and camp with my dachshunds a lot. So in the beginning, it was just me sharing pictures of our travels, doing that stuff. So.
Wow, that's so sweet.
Yeah.
Yeah.
Yeah, but so it is great to look back.
It is.
But I have you on. Thank you very much for coming.
Yeah.
A couple things. So, it's a long title. I'm not even going to try the second half of the title because I will butcher it probably. But the book you co-authored, the Honey Have You Squeezed the Dachshund?
Yes, co-authored a book with my friend Kristen Bryan, who does a lot of great dachshund rescue down in Atlanta, Georgia area, and we decided let's put a book together with some images called "Honey, Have You Squeezed the Dachshund: A Pet Owner's Guide to Dogs that are pet owners terrified of IVDD." Because as a veterinarian myself, I'm limited on my time in the exam room. You know, maybe I get a good solid 30 minutes or whatnot to really give you that face-to-face contact. And when we talk about something like this is very serious. This is, it's personal. It could be potentially life-changing for both ends of the leash. And, you know, it warrants more than just a conversation in an exam room. Of course, there's like rechecks and so forth that we talk about. But I figured let's put a book together so we can empower pet parents, specifically French Bulldogs now are #1 for IVDD, but and
Really?
also Dachshunds.
I knew
Yeah.
they're very common, but I didn't know they were #1 now.
Yeah. They bumped out the Dachshunds
Oh,
now.
wow.
They're officially #1. So, but yeah, so let's figure out what we could do. And then also those that have intervertebral disc disease that may be, that have loss of motor function, you know, it's not the end of the world. I had the book was based off of one of my dogs, Cosmo. It was a patient of mine that I ended up owning because his owners couldn't care for him.
Yeah.
And so I've had him for 12 years. So I had to express his bladder. So that's where the name of the book comes from.
Yeah.
Because
Right.
I'm like,
yeah.
did you squeeze his bladder? Did you squeeze it? So, but that's where that book comes from. But it's really great. And it's nice to hear from so many that the book has been really helpful. They have it in a lot of neurology veterinary hospitals. A lot of hospitals carry it just so that way there's some education there. But it's available on Amazon. So,
Yeah.
yeah.
Well, I love it because even just the title sounds real and accessible. And that's what I'm all about on my blog and all of my stuff is, you know, it is terrifying for people. I'm in tons of dachshund groups on Facebook and people are so fearful about it. And so one thing in the book that kind of resonated with me most was just the quote that IVDD is an inherited condition, not injury. And I'll ask you to talk more on what you mean on that. But what I see a lot is people saying, oh, you know, I don't want to say blaming other owners, but saying like, oh, you can't let them go do the stairs because your dachshund will injure its back, you know, and you know, or you can't let them hike. Like I got told once, so the old one, Gretel, older one, she was diagnosed in 2016 with stage 2 IVDD, and she lived, she was 6 at the time, very active life, hiking. We'd hike like 15 miles in a day. And my life flashed before my eyes, you know, and I knew about IVDD and was watching really close. And so that's part of the reason the vet said that we were able to catch it at stage 2. But my point being, I had a couple people that know me for a long time that said it was my fault because I took her hiking. And it was my fault that it happened. So tell me a little more about what you mean about it being an inherited condition, not an injury.
Yeah, so this is a genetic component that's associated with it. We know that there's a location on a chromosome that has a link to IVDD, and there's two types of IVDD. There's type 1 IVDD in dogs and type 2, but specifically this one, a DNA test does test for type 1 IVDD, and it's if you do a genetic test, it's usually through a swab. So it's a salivary test or whatever. You send it out to the lab, and then you get the results. And I did it on my own, for instance, for Clark W. Griswold, one of my dachshunds, and he did end up having the gene for it. And what does that tell you? Well, it kind of lets you know to prepare yourself a little bit for it. So and so knowing the fact that, to your point, it's not your fault. You can have, listen, I have ramps out of the house. My house looks like, MTV Cribs for Dachshunds.
Is it Clark that scoots down the ramp, slides down?
Yeah, he's the one that takes my shoe down the ramp, all that stuff. So, and, they all carry the genetic marker for it. So, yeah, I want the listeners to know that please don't feel like it's something that you did. Now, that's part one. But part two is we all know that dachshunds think they can fly.
Right.
And they like to be like raging lunatics or whatever. It's like if Mother Nature could have given them another pair of legs right underneath T12 and T13, which is right in the mid area, that tends to be an area. They probably would be nice and solid with 6 legs. And the other thing I always hear about too, just a fun fact to everyone, that when I talk to boarded veterinary rehabilitation specialists, they say that dachshunds notoriously have very weak cores. And what does that mean too? So if they have a weak core, like if we ever try to do our planks, and trying to work our abs,
right,
dachshunds are known to have kind of a weak. So if you look at some of them, they have like a sway back a little bit. Their muscles aren't necessarily super strong along their spinal canal there. And that's just part of like the chondrodystrophic breed, the long back dogs. Corgis, basset hounds are also kind of known to have weak cores, which can be more susceptible in them rupturing a disc for IVDD.
Yeah. Yeah, but that's part of why I'm a champion for, like, I want to help. I run a dachshund club in Seattle too and stuff. Help other dachshunds be active. Not everyone's going to hike 15 miles. Not every dog wants to hike 15 miles, but, use your best judgment. But I swear that, so after Gretel was diagnosed, I did what I always do. I panicked, light flashed before my eyes, and then I said, we are doing this. And I went right next door and I scheduled appointments with the rehab veterinarian. So we worked with the rehab veterinarian that gave us all the core strength and exercises and everything. However, she said the fact that Gretel had been hiking so much before made her strong, made her core strong, and was going to help her recover more completely or faster. But again, not blaming anybody for not doing that, but definitely I was told the injury probably wasn't as bad because her core was strong, and that she would recover better because her core was strong. And up to that point, that was all just because of hiking.
Yeah, absolutely. It's a big thing. And the fact there's some exercises that all of us can do even before, if they rupture a disc. This is just in general, like the one video that I posted called the cookie stretches, where you take a treat and you bring it to the side of the other side. Those are really good things that they can do to help, strengthen their core. Also, there are not many veterinary neurologists out there that do this, and this is somewhat of a discussion, I should say. There is something called a PDLA, and it stands for percutaneous disc laser ablation. And what that is, it's almost like a preemptive form of fusing some of those discs before they start to rupture a disc. So it's questionable in terms of success and all those things, but I know one neurologist that does it in this area too. But yeah, it is just something that we should definitely mention to your listeners, of course, that's out there.
Yeah, there are a few of my listeners who or followers that have done it, and they have nothing but good things to say about it. They're big champions for it. So
good.
So I guess to sum up really quick for people, there's genetic component, there's environmental component, but I think at least, but you're the veterinarian, that you have to have wolf to cause an injury, because if they don't have there's acute injury. Like if a dog gets hit by a car, they're going to hurt their back or do something. But as far as the Hansen's type 1 and that, to have a disc rupture because of it, it already, this has to be compromised for the most part, which, so they have to have genetic component already, right?
Right.
Yeah.
Yes.
Yeah. So,
Yeah. And another point to talk about with this is not every dog needs surgery for something like this
mhm.
too, depending on the severity of the condition or the disease. I went through this personally with Clark in July, where he was starting to look a little ataxic and wobbly in the back end. I was like, oh no. And I consulted with a neurologist, and we was like, he does not need surgery because he's ambulatory, he's walking. So we got him on a good combination of medications that really helped, along with laser and acupuncture, which I'm a huge fan of. And like he's back to his normal self. So but if they are down, if your dog goes down, I can't stress this to you enough, though, is that they need to be seen by the veterinarian because some people either wait too long, they wait a few
Mhm.
days, they lose paralysis or deep pain to those feet. So it's so important to get them evaluated.
Yeah, that's what I had to took Gretel to the emergency vet, and that's what they told me was that a lot of owners miss the signs, and so they don't bring them in until it's really gone to the point of needing surgery and being paralyzed. Whereas I saw first little inkling and took her in, and
Mhm.
you know, not saying like I hear stories all the time where dachshunds are in a bed sleeping, they were totally fine, they wake up, they all of a sudden can't walk. So it's a
Yes.
lot of luck that that didn't happen
Yeah,
to her. However, had I still missed the very subtle signs, it could have progressed to something like that. So
absolutely.
yeah. So okay, well I have one other burning question for you.
Yes.
Um, I've heard you say a couple times that age is not a disease, and because I have Gretel, 14 and a half, my my first dachshund, Chester, he developed dementia. Physically, he was fine the whole time, but he lived until a few minor things, but until he was 16. And Gretel does not have dementia, although she has a little bit of cognitive decline and is losing some sight. But in my mind, I don't know. I know the average lifespan for dachshunds is 16, 17. So I expected that the wheels wouldn't fall off the bus until she was 15 or 16. And here we are at 14, and her wheels fell off at 13, which seems really young to me. At 13, Chester was still acting like a middle-aged dog. So there's definitely, to me, like, I understand, back when I was a kid, people were just like, yeah, it's an old dog, and they would just kind of let whatever it was run its
Yeah.
course. And now, some of us, every little thing we're running to the vet. So I understand the age is not a disease, but there has to be like normal aging ailments, things that are going to happen. So what's the line between something you shouldn't ignore and something that is truly just age related and expected?
Yeah. Thank you for this because it's one of those things that I will never put in a medical record. What's the diagnosis? Age.
Right.
That's just not a diagnosis. It's not a thing. But there are things as they progress that they can develop Cushing's disease, heart disease, cataracts, osteoarthritis. Those are things that are by no means what I just mentioned a death sentence. They're manageable as these guys get older, of course. So, what I always try to do is prioritize the priorities, is what I say to my pet parents. They have a little skin growth that's a little cyst or whatever. Let's let it be. But bumping into things, not eating, let's talk about those things. Let's talk about the dental disease potentially. Are they a good candidate for general anesthesia to have those teeth cleaned? And if not, let's talk about that. What can we do to make sure that those teeth can stay a little bit healthy? Mental stimulation. I do think that we need to chat a lot more about it. Fortunately, there's a lot of greater research that's showing things that we could do to increase engagement. We see a lot of those snuffle mats and puzzle toys and lick mats that are out there now. Those conversations should definitely be dedicated also to our geriatric dogs too. And again, understanding the aging process in our dogs. When I hear pet parents like, oh, she used to not jump in her bed anymore. And I go, in the words of Ariana Grande, I go, yes, and? Because would you, at the age of 80, be jumping in your bed and rolling around like a lunatic? So we have to realize that puts things into perspective that It's part of life. It's the
Yeah.
circle of life. They are not going to be doing those things. Yes, it may be hard for you to see those things because they age faster than us, but we have to be there for them and support their needs as they get older. I have a video coming out later this week talking about this because there are great exercises that we could do, physical therapy exercises we could do for our older dogs, keeping them nice and mobile, keeping them going on different substrates so they work on their balance because we don't want
Hmm.
them to lose their balance because that's why the
Yeah.
number one fear that dogs have when they're with me at the veterinary house was the fear of falling. So if
Hmm.
we can keep them nice and on balance and keeping their nails nice and trimmed so they have good substrate, so important. And then keeping them mentally stimulated as well.
Yeah. So I've been trying to do that more with Gretel. Like I just really got the importance of um because I do lots of mental stimulation for my dogs. I also Dachshund sit. So I don't
Yeah,
mean the dog hotel, not quite that, but because I live in a really small house, but I have up
yeah,
to three at a time. So I'll have six here in the house. But so I have all kinds of enrichment toys, mental stimulation, keeping them entertained. It's like my full-time job.
yeah.
But Gretel, I was kind of, I wouldn't say ignoring her, but not prioritizing the mental stimulation stuff with her because oh, she's just old, she just wants to sleep. But I've been stepping up my game in that realm. And just yesterday, um, we had to go to the vet again, and we were coming back, and I stopped to do something. And as I was walking back out to my car, there was a bird feather on the ground. Now it wasn't obvious that it came from like a sick or dead bird. And so
Yeah.
I was like, meh. So I like picked it up and I took it in, and she was just sleeping in the car, and I set it there, and she was like, and she was like sniffing. She was so excited. And I noticed even when Chester, my first one, had dementia, um, it's amazing what just being in the outdoors does for them because, and with Gretel too, when I take her camping, she's a different dog than she is at home because
Yeah.
she gets all the mental stimulation just out in the world, like alerts her, makes her more alert.
Yes.
It's so obvious. It's a huge difference. And so that is, I think, really important. I just wanted to touch on and let you speak a little bit more, but sharing my experience that so earlier this year, we found a mass on Gretel's spleen. And
Hmm.
I'm sure you're familiar with it, but went through the whole thing of they also found through ultrasound that she may have tumors throughout her liver, um, which is not removable. so,
Yeah.
so it was like, do we choose to let her go? Because I'm big on not letting a dog suffer too long, and do we let her go? Do we do the surgery? 50% chance that it might not be cancer. Would we do, just running through the whole gamut anyway. But we did get the surgery, and it wasn't a cancerous tumor. They biopsied the liver, didn't. They said the biopsy came back clean, but my regular vet, my, my regular vet is like, yeah, but based on the ultrasound, I can like they might not have biopsied the part where this was. So anyway, it's a whole other story. But the point being that I have had to this year prioritize like her spleen tumor and all kinds of stuff. And I am ashamed, embarrassed to say, but yet not really letting myself off the hook that her teeth, for some reason, in this last year, especially 6 months, while we've been prioritizing these other life-saving things, are the worst any of my dogs have ever been. They're close to like those horror pictures you see. A few of the teeth are that you see on the internet of like they show a dog's mouth. Oh, I thought you were going to bring one back on camera.
You're good. Of course, like the lawn guys here. So that's why, hey, we're like,
Yeah,
you
no
don't have to
problem.
be here.
My listeners actually like hearing the bloopers, the dogs barking in the background, so it's all good. But and part of me feels like because I've seen those pictures on the internet, and I'm like, how
Yeah.
could you ever let your dog's teeth get that bad? And now here we are, and it's me.
Right.
And I'm like, I
Yes.
can't believe it. But at the same time, I had to prioritize other things. I didn't know she was going to even make it, let alone
I know.
the teeth. We were anyway. So we went to the vet yesterday and talked to him about it, and she's got gum disease and everything. So I'm choosing next month. I have an appointment to put her under again, and because the spleen surgery was just in May.
Okay.
and to clean her teeth, because I don't want her to be, there could be something going on under the gums that could be causing her pain, and I want to go for like quality of life, you know.
Right.
I know it's a risk putting her under, but they need to be clean. It's not really a choice, you know. So anyway, but the point being that you prioritize, like, and she's got all kinds of fatty lumps, and I'm not even having them biopsied at this point, because I'm like, the teeth are more important now than the fatty lumps. And, you know, because the vet
Right.
wasn't concerned really. He was like, I think it's just a fatty lump. And so yeah, when they get older, it's all about priorities, and there's so much up and down. One day I think that she might not be around for long, and then the next day I'm like, I can't believe how well she's doing, and it's not for the faint of heart having a senior
Right.
dog.
No.
So,
It's a roller coaster ride. And shout out to you for being so amazing and awesome to going through that, because that is a huge emotional roller coaster, not knowing the unknown about whether that spleen was going to be like a
yeah.
hemangiosarcoma or a hematoma, you know. So I've been through it on both ends. I've dealt with my dog, unfortunately, succumbed to hemangiosarcoma on the
Mhm.
spleen, but also making that diagnosis. It's exactly what we talk about, the 50-50 shot, one third rule, all these things. But and then get into the teeth. Yeah, I mean they need to be comfortable, and I know a lot of you out there get concerned about anesthesia. It has come a very very long way, and you're taking all the necessary precautions about it. And you know, they get hooked up to everything you and I get, but you want their teeth to be, they got to chew. They got to have,
Yeah.
you know, healthy, or they may not have to chew. They might gum things if their teeth are so bad, you
Right.
know, they have to be
Well,
pulled.
well, she's an
So,
inhaler of her food, but the biggest thing to me is she's super food motivated, and she no longer can get through a regular little, like the no hide, the thin little small
yeah.
dental chews or something, and that's not normal. So there's something going on with her teeth, you know.
A dachshund food motivated? No.
Right? I will tell you, the vet's like, oh, you, because I feed right now, I'm feeding part kibble, part raw, half and half, and then
Uh-huh.
like kibble in the morning. And then, well, does she still, oh, she's eating kibble, does she, you know, so she's chewing. And I was like, no, that's a mutually like exclusive question. Like, she eats kibble, but she does not
Right.
chew it. She's never chewed it. She just inhaled it. She literally goes at the dish so hard. She used to eat in a glass bowl, and I could hear sometimes her teeth clanging against the bottom of the dish.
Oh, wow.
She was like bam, 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 like just gobbling the food. She's insane. And so she eats in a slow feeder, and like, you know, I do all the things to try and slow her down and stuff, but she
I
doesn't chew
love
her
the
food.
slow,
So.
I, I love those slow feeders too. That's what all the boys have in my house too, is the slow feeders. I think it's the best thing. Yeah,
Yeah.
big fan of.
Well, I noticed she was gulping so much air when she did that she would be bloated
Yeah.
afterwards. You
Yes.
know,
Yeah.
and
Yep.
and she was uncomfortable. It didn't harm her, you know, but she was just really uncomfortable, and I was like, oh, well, we should switch this up now, a little
Yeah.
slower. So, okay, well, I thank you for your time. I know you have to go, but is there anything else that you want to kind of plug while you're here, or something that you think is really important for dachshund owners to know and understand from a veterinary perspective?
Yeah, I think from the veterinary side of things, staying on top of their needs is so important. Of course, so we know that their back is a big thing. Their weight is another thing I want to leave you all here with. Keeping them nice and lean at a good body condition score. And if you don't know what that is, I have a lot of videos on my TikTok on that. Dr. Adam Christman 52. We can check it out.
And
But
I've written
we're
lots of articles about it too. I'm a huge
good.
proponent of that. Always have been.
Yeah, we want to keep them nice and lean, and really important for them to have good longevity to them, and staying on top of their basic needs, like we just talked about, intervertebral disc disease, getting blood work done on them, getting them screened for things like cardiac and endocrine diseases such as hypothyroidism and Cushing's disease. And these are all things that are manageable. VetMed has come a long way. I will share with you that there are 3 probably 4 new drugs that are going to be coming to market very soon. That's going to be like, holy smokes, this is amazing. So stay tuned. The veterinary profession is getting a boatload of
Can
great
you
new
say
drugs.
what the medication will be for?
There's,
Addressing?
yeah, one I can say is for itching,
Okay.
so anti-itch medication. Another one's going to be for dog longevity, improving the quality of life. There's going to be another one for eye medication,
Okay.
which is a really cool one,
Yeah.
and then one for cancer. So, so be on the lookout for them. Really great stuff that's there, and I will share it as soon as I get made it available. So
Okay.
on Instagram as well, Adam_Christman, and my webpage is dradamchristman.com.
Okay. Well, thank you very much.
My pleasure. Thank you.
Yeah, and I will let you go to your next meeting.
Okay, sounds good. Bye,
Thanks.
everybody.
Bye.